Hi, my name is Trey Johnson. I'm a board-certified sports physical therapist here at Great Plains Health. We just wanted to talk about, with the fall sports season kicking off, the importance of our pre-season concussion screening and the role that it plays with return to sport testing so that we can return our head injury patients back to athletic performance. So for our preseason testing, we started using a system called Excellent Brain. It consists of a neurocognitive assessment for some visual, ocular tracking. It just kind of helps us see how the athlete's brain is functioning at a baseline level. Post-injury assessment-wise, if I pull a kid out of a game, we're giving their parents information on kind of red flags to look at and if they need to go to the ER. Then we'd like to have them in the clinic the next day for our post-injury testing with Excellent Brain that will compare their baseline scores to their current score. You know, it involves kind of a similar assessment with a vestibular ocular motor screen, treadmill testing, head neck assessment, just because there can be a lot of issues with head neck control. In terms of concussion awareness and management, coaches play a huge role. The way our system is set up, if they report an incident on Excellent Brain, that flags our athletic trainers to come out and take a look at the kid and do their brief assessment to rule in or rule out if they have had a head injury or not. The parents' involvement in our concussion program is just really monitoring the kids at home. You know, mental health we're more aware of it right now, and our testing does take a look at kind of some irritability and emotional changes in kids that we can get with head injuries. So parents have kind of a big role at home with managing those symptoms and letting us know how they're responding. Concussion management has evolved largely in the most recent years. Years ago, it was still the terms of going into a dark room and resting. We've taken a lot more of an active approach with rehab, and we can get kids back to returning to play faster at this point in time. We get kids that kind of range from concussions to day after, 2 months after. And just after getting on a formal rehab plan, it's amazing the progress that they make in just a couple weeks in terms of their schoolwork. You know, being able to function through an entire school day, because a lot of times that's what kids struggle with early on. And returning to school first is always our number one goal before returning to sports. We've been able to kind of progress some kids through post-concussive training, you know, within a matter of a week or two, just to get them back to the sport that they love and the sport they want to do. If you have any questions regarding preseason concussion testing or any of our concussion assessments or screens, feel free to contact either your school athletic trainer or our rehab clinic at 308-568-7456.